Dr. Handel is on our planning committee and helped us form this conference. And he runs a sport rehabilitation clinic here in Rhode Island.
Hello, I'm Dr. Tod Handel, and I'm a physician here in Rhode Island. And I've gotten involved with the Rhode Island medical marijuana out of the fact of if I don't do it, then who does? And I want to welcome everybody here to New England. Doctor, I heard, fix my pain, which is easier said than done. I'm a physiatrist, who's a doctor of physical medicine and rehabilitation, and I practice interventional pain management. What a physiatrist or a doctor of physical medicine and rehabilitation does is they treat and restore with the goal of maximizing function. So it doesn't matter how much it hurts, it matters what you're able to do and trying to get them to live with their pain. And pain is something that somebody's living with, and how can we make things tolerable for them? My field involves a mix of orthopedics with musculoskeletal medicine, neurology, rheumatology, and are really known as the quality of life specialist. Treating acute and chronic musculoskeletal conditions, and really with a physician for those with disabilities. So we're going to talk about the rules and regulations, and Charlie Alexander did a good job explaining from the perspective of the health department, and I want to give a little bit of the twist, and a lot of the information I'm going to repeat. But this is the list of the laws, and this is public information. And we have several governing bodies that are involved in our laws. We have the Rhode Island law and the federal law. And as you may understand, it's legal medical marijuana is legal in the state of Rhode Island, but it's not legal federally. So from a federal standpoint, what we're doing is illegal. And the Attorney General has said that they're not going to go after compassion centers, and the push for the federal government is to keep it from a local level. But who knows what's going to happen with the next administration? And what the U.S. Sentencing Commission found, that 99 out of 100 marijuana arrests in the United States are made under state law, rather than under federal law. Listed a couple of states that do have a medical marijuana prohibition. These are all taken from the statute directly. I didn't type these. This is all cut and pasted into my slide presentation. And the states are not required to enforce federal law. That's the job of the feds. State law should make a distinction between medical and non-medical use of marijuana. We're asked to make a distinction as a physician to make the diagnosis of a debilitating medical condition. And this is one of the difficult things of being a physician is, what does debilitating mean? Someone has some of these conditions. Some of the conditions are cut and dry. A diagnosis of cancer is a pretty cut and dry diagnosis. Whether someone needs medical marijuana for cancer, that doesn't actually state it. But cancer, glaucoma, HIV, hepatitis, or the treatment of, and so this is useful for the treatment of these conditions, or a chronic or debilitating disease or medical condition, or its treatment that produces one or more of the following: cachexia, or wasting syndrome, severe debilitating, chronic pain, severe nausea, seizures, including but not limited to those characteristics of epilepsy, severe and persistent muscle spasms, including but not limited to those characteristics of multiple sclerosis, Crohn's disease, or agitation of Alzheimer's disease. Let's come back to this. What is the medical use of marijuana? Medical use is defined as the acquisition, possession, cultivation, manufacturing, use, delivery, transportation of marijuana or paraphernalia relating to the consumption of marijuana to alleviate a registered qualifying patient's debilitating medical condition or symptoms associated with that medical condition. So it's not just smoking it. Who is the practitioner? Which would be me, or physician assistant, nurse practitioners, are the person who is licensed with the authority to prescribe drugs a physician who is licensed with the authority to prescribe drugs in Massachusetts, Connecticut, or Rhode Island. But one of the definitions that I want to make sure you understand is, in Rhode Island, we're not prescribing marijuana. I'm not saying to smoke 3 times a day. What I'm doing is I'm certifying somebody with a medical condition. And there's a difference there, because I'm not saying to take 20 milligrams of OxyContin twice a day. I'm saying that this person has a chronic debilitating condition, and therefore, under the law of the state of Rhode Island, it is that patient's right to have marijuana available to them. So I'm not making the decision whether the person should use marijuana. All I'm doing is stating they have a diagnosis that it may be a benefit for. Am I protected under the law? Well, I'm protected under Rhode Island law. I do have a Rhode Island license. I also have a DEA license, which comes from the federal government. So most physicians in Rhode Island are still petrified of being prosecuted for the involvement in the medical marijuana program. The law does protect you, but to what degree? And there's always going to be a loophole within the law, and so physicians out there are still scared. But the law does state clearly a practitioner shall not be subject to arrest, prosecution, or penalty in any manner, or denied any right or privilege, including but not limited to civil penalty or disciplinary action by the Rhode Island Board of Medical Licensure and Discipline, or by any other business or occupational or professional licensing bureau solely for providing written certification or for otherwise stating that the practitioner's professional medical opinion, the potential benefits of the medical marijuana would likely outweigh the health risks for that patient. Now, what they don't state is who can go after me. Can my insurance company drop me because they think I'm a liability? Again, can I lose my license from the DEA? Am I still susceptible to federal law? And we really don't have that answer, but I will say in the defense of Rhode Island, I feel fairly protected, and I feel comfortable as a practitioner in my participation in a certifying physician for patients from the state of Rhode Island. Now, is it okay for other people to talk about medical marijuana, whether it be a nurse, someone who's not prescribing medication, such as your pharmacist? Is your pharmacist allowed to talk to you about it? And I heard about a nurse who lost his license for talking to a patient. And in the state of Rhode Island, you are able to talk about medical marijuana as a professional to a patient and be safe from the same prosecutions of the Rhode Island state law. The patient certification it's a written certification where the practitioner shall provide written certification for their patients on such forms that is provided by the state and shall specify the qualifying patient's debilitating medical condition. Written certification shall be made over the course of a bona fide practitioner-patient relationship. After that practitioner has completed a full assessment of the qualifying patient's medical condition. Again, one of the questions is what is a patient-physician relationship? This is the form that physicians are going to fill out, and it's basically filling out a checkbox and then putting in a diagnosis. Now, personally, when I fill this out, I state what their qualifying condition is. I'll state that they've had a failed back syndrome, they've had 2 back surgeries, and they're currently being maintained on opioid pain medication, and it's the hope that the use of medical marijuana will decrease the amount of prescription medication that they're requiring. I'm not going to state that part, but I will state exactly what their diagnosis is. And again, it's cancer, glaucoma, HIV, AIDS, hepatitis C, or a chronic debilitating condition such as cachexia or wasting syndrome, severe debilitating chronic pain, severe nausea, seizures, severe persistent muscle spasms, but not limited to those characteristics of multiple sclerosis or Crohn's disease, or those symptoms related to Alzheimer's. Then we're asked to sign this form and state that I certify that I'm a physician duly licensed to practice medicine in Rhode Island, Massachusetts, Connecticut. I have a relationship with that patient. The above named patient has been diagnosed with a debilitating medical condition. Marijuana used medically may mitigate the symptoms or effects of this patient's condition. And further, it is my professional opinion that the potential benefits of medical use of marijuana would likely outweigh the health risks of the patient. That is what a physician is certifying. And so if you're in agreement that this patient has a qualifying diagnosis, you discuss the risks and the benefits with that patient, and then you sign. You're not prescribing it to them. All you're doing is stating that they have that qualifying diagnosis. So I have a couple of questions for the Department of Health. What is a chronic debilitating pain? Can the patient still work, but they're disabled? What physical manifestations do they show, and who makes the definition of debilitating? Where do patients get it? And that's where the Compassion Center comes in. What risks do I counsel patients on? And one of the questions is, if I'm referred a patient for medical cannabis by another physician who is not comfortable with filling out this paperwork, and they're asked to see me as a referring physician, they know that I'm knowledgeable about medical cannabis, they're asked to see me, I see them for a one-time evaluation at a recommendation from another physician, does that constitute a bona fide patient-physician relationship? You can appeal for other conditions that's already been stated. I'm just going to skip through this. Protections for medical use. We went through this. Charlie did a good job going through this. The primary caregiver is someone assigned by the patient to grow medical marijuana for them. Minors are able to get it. If you're doing the counseling, you have to do that with the patient as well as with their guardian or, who has legal custody, and the guardian has to be one of their caregivers. Restrictions of where you're allowed to use marijuana. You're not allowed to use it in a school bus or public form of transportation, on school grounds, in a correctional facility, in a public place. You're not able to operate a motor vehicle, but while you're smoking marijuana, but if you have it in your system under a blood test, well, it's obvious that they may have it in their system, but you're not able to use it, be under the influence while you're operating a motor vehicle, and I counsel patients about that. The government, the chapter specifically states that a government medical assistance program or private health insurer is not required to reimburse a person for the costs associated with the medical use of marijuana. An employee does not have to accommodate the workplace, because there is a cost for doing medicine, and patients need to understand that there's a cost for patients' evaluations. The Compassion Center is a center that is hopefully that's going to get up and running in Rhode Island. I'd like to see it done safely for the protection of the Rhode Islanders who are involved in the medical marijuana program. Skip this part. But the state of Rhode Island, the Department of Health did release the list of physicians who are in Rhode Island who are prescribing medical marijuana. One of the problems I have with the state is the Health Information Protection Act was protecting the patient's rights, but it didn't protect the physician's rights. And so they released all the physicians that have written for medical marijuana, including the dean of Brown Medical School. And they found that 38% of the physicians, the top 10 physicians wrote for 38% of the patients. Here's the list, and notice that I am number 31 on the list. I've written for 31 patients, number 6 on the list, and they had an article where Rhode Island doctors tell why it's okay for medical marijuana requests. I hope that this has been helpful. Thank you very much.